I am willing to be the discomfort because history has shown that discomfort is what awakens change. Every holiday season, there is a surge in confident claims, new protocols, miracle angles, and bold declarations about endometriosis. But this year, the noise is louder for a reason. We are watching decades of ignored and minimalized realities finally being acknowledged at an institutional level. Now, it's not because the science is new, but because the messaging is shifting. And instead of this truth being used to strengthen accountability, much of it is actually being pulled into marketing cycles, PR narratives, and social media hype. Old theories are being repackaged as breakthroughs. Emerging science is being blended into outdated frameworks. And instead of clarity, patients are getting confused and it's being dressed as progress. We are seeing this with the renewed attention on the cancer crossover. Endometriosis has long been associated with increased risk of certain ovarian cancers, especially clear cell and endometrioid subtypes. But this is not new science. What is new is the acknowledgement. The problem is not the risk that it's finally being stated. The problem is that it's being selectively framed or dramatized in headlines, and it's used to position institutions as innovators instead of being used to improve the surveillance, the outcomes, and that accountability. And then when patients begin to speak honestly about risk, progression, organ damage, bowel and urinary involvements, nerve involvements, and even death in severe undertreated disease, we are accused of fear-mongering. But naming real harm is not fear-mongering. It's truth. Discomfort has never been proof that a truth does not deserve to be spoken. That same pattern is happening across treatment narratives. Symptom improvement is being marketed back to patients as some sort of proof of biological disease control. And those two things are not the same thing. Some people might feel better on supplements, peptides, GLP-1 medications, gut protocols, detox regimens, and other holistic type programs. And quality of life does matter. Nobody is arguing that fact. But feeling better does not mean the disease itself has changed. Instead, endometriosis is actually a biologically active and self-stimulating progressive disease. It can continue to progress even when that inflammation and the hormones or the environmental irritants are improved. The ground surrounding the lesions may become less reactive, but that does not erase the entire disease itself. And right now, we are actually watching a growing trend of interventions being marketed as if they do. This includes non-regulated peptides, gut health protocols, and GLP-1 medications like Ozempic. Some people are reporting reduced pain and flare frequencies while using these medications, but that is symptom response and not proof of disease modification. They're also notating that when they finish taking the medications or they stop, that their symptoms do dramatically come back, which is what we see in a lot of other treatments that are being given to the community. These drugs carry serious and sometimes irreversible side effects, and lived experiences reflecting that reality are already emerging within the community as well. Relief matters, but relief should never be sold as some sort of biological reversal. We are also seeing this misunderstanding around NACs and castor oil packs. Some people feel less bloated and notice less pelvic pressure. In some cases, imaging even appears to show cysts looking smaller, but imaging can change when inflammation around the structure decreases. And many of these cysts were never pathologically confirmed as endometriomas to begin with. Visual change does not equal verified lesion change. And that's something that is so misunderstood. Symptom improvement is valid, but marketing symptom improvement as disease regression is not. And I know you've been waiting for me to touch on this one. We're also seeing the surge of the hype around the gut microbiome and new claims that antibiotics may treat endometriosis. And this is another place where nuance is getting completely lost. Some of these claims are coming from mouse model studies where disease-like tissue is surgically implanted and then exposed to targeted antibiotics. These are induced inflammatory stimulations, not naturally occurring human disease. And when antibiotics appear to reduce lesion appearance or signaling in mice, this does not prove that they treat endometriosis in humans. And we need to draw a very important distinction. Endometritis is an infection of the uterine lining. It is bacterial. It can be treated with antibiotics. But endometriosis is not an infection. It is not inside the uterus. They are not the same condition, even though they are constantly confused in the headlines, research summaries, and patient conversations, and as well as celebrities such as Whoopi Goldberg herself. Treating endometritis with antibiotics does not mean endometriosis can be treated the same way. Many people with endometriosis have already taken multiple rounds of antibiotics across their lives for suspected pelvic infections, urinary issues, sinus infections, dental infections, and unrelated illnesses without any changes in disease behavior. If antibiotics were capable of treating endometriosis at a biological level, we would have seen some sort of consistent outcomes long before these media cycles, right? Yes, researchers are exploring whether the microbial environments may influence inflammation around that disease in some subsets of patients, but right now we are actually looking at association, not causation. Environmental interaction, not proven disease origin. Until lesion-level human evidence confirms otherwise, antibiotics and microbiome targeting should not be framed as endometriosis treatment. I'm going to repeat that again. Antibiotics and microbiome targeting should not be framed as endometriosis treatment. And none of this replaces the need for any type of multidisciplinary support: nutrition, physical therapy, pelvic floor care, pain management, mental health support, and holistic stabilizers can all improve quality of life. They can support the body, but they are not cures. And testimonials are not pathology. Even surgery is not immune to misrepresentation. Not all surgeons are equally trained, and dismissal after recurrence is far too common. Outcomes are impacted by training, pathology follow-up, and honesty about probability. When patients are blamed, abandoned, or labeled difficult instead of tracked and supported, the system fails twice. Hope is not the problem. Misrepresentation is. And this is why, on Christmas, I'm choosing to say this out loud, and not to scare anybody, not to shame anybody, but to give something that has been denied to this community for far too long: the truth. Because for many of us, survival has depended on truth more than comfort, more than sound bites of hope sprinkled with misinformation. And honesty, even when it's uncomfortable, is one of the most powerful forms of support we can offer one another. And this is my Christmas gift to the endometriosis community: a reminder that symptom relief matters, supportive care matters, and multidisciplinary healing matters. And none of those things should be sold as cures, marketed as biological reversals, or used to silence people whose disease continues to harm them. You deserve care that does not confuse relief with control and does not sell certainty where evidence does not exist, and does not ask you to sacrifice accuracy in the name of optimism. My role here is not to soften the truth so the systems feel safer. My role is to speak the truth so patients feel safer. And if the truth feels uncomfortable, then I am willing to be the discomfort, because history has shown that discomfort is what awakens change. From my heart, this is my way of showing up for you this Christmas and year-round. Not with false promises, but with honesty, protection, and love for this community.